So I'm talking on a topic which we all know aware of. It's the new breakthrough technology after the MIVS, which is using a 3D visualization system for vitreoretinal surgery. And most of you are familiar with this kind of technique and are probably using it themselves in the ORs in their respective hospitals and medical centers, ophthalmic centers. But here at the RP Center also, the AIMS, we use this since the last about 3 years. We've been using this Ingenuity system with the which actually gives us high definition, high magnification, and very good color contrast. And it's also being a teaching hospital helps our residents to watch exactly what we do. They also see the same. So there is a 3D camera, and it's a high definition camera. You got a flat panel visualization, which helps you to watch, because it's all a pixelized image. It's a digitized image. So unlike analog microscopes, the digitized images can be enlarged in size to a great extent, and the magnification afforded is really great help. So the OLED screen, 4K OLED screen on which the surgeon views the 3D, uses passive Polaroid glasses, not the active ones. So you just sit there and look up at the screen, not at the eyepieces, because the eyepieces have been taken off, and there in fact you have the 3D camera. And so this is just to show you. So this is on the screen, this is trying to show you live the screen. So that's a constellation making its noise. So we got a diabetic vitrectomy in which we try to cut through with a 27 gauge cutter. So the 27 gauge cutter also lifts up the tissue, as well as it's got a multifunction level, and also cuts. So make sure it doesn't cause breaks. And we had an extensive layer of fibrovascular proliferation. This was done about a week back. So I picked up this fresh videotape. So that's a short clip I wanted to show. So what has happened is the Ingenuity and the Constellation can be fused together, and you can have all the data, including the IOP, the cut rate, and the vacuum, everything on the Ingenuity screen on the sides, and that's what's called data fusion. You got a lot of ergonomics, because we sit back, we don't peep into the microscope eyepieces. So that's the way it is, straight back. Look at the screen, and tone. We normally use much less light as compared to the analog viewing through a microscope. And this is something I've noticed, that the light used much less, so less chance of photic or phototoxicity of the macula. Light exposure is also less because of that. The digital, as I told you, digitized images can be really magnified, and you can pick up tiny breaks or something, which I'm sure may be missed, may not be missed, but in the analog routine microscopes. So I've seen a whole lot of such findings over my 3-4 years of experience using the 3D Ingenuity machine. Ingenuity, it's a viewing system along with the Constellation. So this is just showing you a diabetic vitrectomy with the magnified view, and because the view is so magnified, you can exactly know the plane of your surgery and the dissection, because it's important to know the plane. If you're not in the correct plane, you actually may create breaks or more bleeders, or if you know the correct plane, and you can pick up the posterior hyaloid as well as the fibrovascular proliferative tissue. So here it wasn't so densely adherent. So I'm just trying to show you that Ingenuity VR viewing system really helps you to identify the planes. And this was the post-operative result, and the quality of image is extremely good. It's natural tissue color. It's no pseudo color like you get in the Optos, or which are wide field images which you get in many other systems. But this intraoperative live, you get two color pictures, and that's a big advantage. You know exactly the color of the retina, what are the spots which are abnormal. So we've written a paper about it. So also because you're looking at the distance about 3 feet away, so you don't get the asthenopia and too much of accommodation when you're doing VR surgery, which takes longer. So this is just to show you vitreomacular traction surgery. So here also we find that we're using a wide angle viewing system here initially to, and squirting some dilute triamcinolone to identify the posterior hyaloid. This triamcinolone really helps. You can actually then lift up the posterior hyaloid with either forceps, which may be actually traumatic, or you can use the suction of the cutter, and depending on the ease with which you can do the procedure, as long as you don't create any retinal damage or trauma, you need to pick up the posterior hyaloid well and go tangentially, because if you go anterior-posteriorly, you may create a break action. So that should be avoided. So this way, the IOCT, we have the IOCT with it. So the IOCT guidance helps you to make sure that you've not created a macular hole. So we'll relieve the vitreomacular traction and the retina is intact. So once you've not created a hole in the VMT, you're sure that your surgery is being okay. So the other advantages are the filters are there, and the filters will actually tell us in future how well we can see the vitreous, and also stain the ILM. Maybe we don't need to stain with the dye, we just, the filter itself kind of colors the macula, the ILM, and you can peel the ILM. Well, I'm not so good at that. I still use the ILM blue or the brilliant blue G dye in India. So this is one last video I'm trying to show you, which was done a few weeks back, and this was a giant tear with the inferior giant tear with a temporal tear and with some degree of PVR fixed folds. So here you can see that the amount of magnification you get and the amount of clarity you get with the wide angle viewing system with the Ingenuity is something that is amazing. And the periphery I can see so well, and it's not that the center is visualized, as many of the authors I've read talk about the center, but the periphery is beautifully visualized. You can see the peripheries, and there are a lot of retinal cysts it's multiple retinal cysts, which of course we're going to wait because they normally disappear. So this will be oval detachment with a lot of retinal cysts, and so we got the retina to flatten out and put oil inside, and we trimmed the edges because the edges were rolled up. So we got to trim these edges because and get the PFCL across, go beyond the edges of the giant tear before you put the laser. So anyway, he did well, and thank you so much.